Well, hello and welcome everyone to our monthly webinar. This month's topic is COVID-19 variants and the importance of testing and vaccination, a very timely subject. And our guest today is Dr. Christopher Brooke, who's an assistant professor in the School of Molecular and Cellular Biology at the University of Illinois at Urbana-Champaign. Before joining the faculty at Illinois, he completed a doctorate in microbiology and immunology at the University of North Carolina and postdoctoral training in viral immunology at the National Institute of Allergy and Infectious Diseases. Research in Dr. Brooke's lab is primarily focused on understanding how heterogeneity and collective interactions within influenza virus populations influence broader patterns of viral evolution and infection outcome. The lab is also interested in understanding the genetics of influenza virus immune escape and transmission with the overall goal of improving strategies for universal vaccination. So please join me in welcoming Dr. Brooke, and I will turn it over to him.
Thanks. Yeah, thanks for having me. I'm happy to be here. Yeah, I guess, do I just ask for the slides to advance and then, okay, so today I'm just going to talk a little bit about SARS-CoV-2 variants, and really, I'm going to cover a few different topics kind of fairly quickly, and then, we can open it up to questions or discussion. And so the first question that I was asked for this is kind of like, what is a variant? And in short, a variant is just a SARS-CoV-2 virus that contains a small number of naturally occurring mutations or changes in their genome sequence. And these changes result in a different behavior from sort of the parental SARS-CoV-2 virus that they evolved from. Okay, and so the way these variants come about really comes from a really fundamental feature of how all viruses operate. And that's that they make tons of random mistakes when they're reproducing themselves. So basically every copy of a virus that is produced typically has, one or two random mutations, give or take. And so most of these mistakes, and I'll put quotations around mistakes, are bad for the virus. But occasionally, in rare instances, some of these random mutations are actually beneficial and give the virus, make it either better at replicating in a given host, or give it some other sort of advantage, whether it's ability to escape from a drug or ability to replicate in a new host, things like that. And so really when I teach virology, I try and kind of use the analogy of like a slot machine. So basically viruses, every time they replicate themselves, they're pulling on the slot machine. And most of the time what happens isn't really good for them. It's their mistakes, or they don't make much of a difference at all. But very rarely, one of these is a jackpot, and a new variant evolves. It has an ability that allows it to outcompete other strains of the virus that are circulating. And so that's what's been going on during the course of this pandemic, that over the just millions and millions and millions of infections that have occurred globally, we've given the virus just so many pulls on the slot machine that we've started to see new variants emerge that are more transmissible in humans. And because you can think of all of these different SARS-CoV-2 strains that are circulating in people as competing with each other, when one has an advantage because it's more contagious, it's eventually going to outcompete the others and take over. And that's what we're seeing with these variants of concern. So can we go to the next slide, please? Okay, so there's a lot of concern right now about what's called the Delta variant. I know the names for these variants the systems have changed multiple times over the past year, so I know it can be confusing. I think even virologists get confused by it. But the details on the Delta variant in particular, so this is a variant that was first detected during the sort of massive spread of the virus in India earlier this year. Very rapidly, it spread to other countries around the world. including the United States. And it did this by outcompeting the other SARS-CoV-2 variants that were already present in those countries. And so you can see this on the left. This is showing kind of what happened in the UK after the Delta variant first showed up there. And the data from the UK is probably the best because they are sequencing more of their viruses, more of their infections than any other country. You can see that, you know, kind of mid-April to early May, the Delta variant first shows up in the UK and very quickly it takes over. And that's because it's more transmissible or more contagious than the Alpha variant that was predominating earlier in the spring there. And so you can see here on the right, these are estimates of people trying to kind of quantify how contagious these different variants are. And you can see the Delta appears to be the most contagious variant that we've seen. But again, this is hypothetical. We're still really struggling to get good numbers on these sorts of things. So Delta seems to be more transmissible than other variants. There's no data that suggests that it causes a more severe infection, which is good. But it does seem very clearly more contagious, and we don't know why. It's certainly because of some subset of these mutations that it has, but we don't really know specifically what it has changed that makes this virus more transmissible than its parent. Okay, so next slide, please. So another question that was asked is how effective shield testing will be against these variants that keep emerging. And so far, highly effective. And the reason for this is because the shield test, like many other PCR-based diagnostic tests for coronavirus, looks specifically at 3 different parts of the viral genome. So the shield test looks for this ORF1 protein in yellow, or gene in yellow, the spike gene here in red, and this purple N gene down here. And so what that means is that even if a variant happens to be missing one of the targets that the test looks for, the virus will still be detected because it's of the other 2 targets. And what we've seen so far is, the Delta variant, still retains all 3 targets of the shield test. So there's no expectation that the specific parts of the genome that are targeted by the shield test are going to be mutated in any of these variants. So that's good. Next slide, please. Okay. And then the next question was, how well do vaccines work on variants? And this has obviously been a really sort of hot area of study because, right now vaccines are absolutely our best sort of weapon in controlling the virus. And as each new variant pops up, there's a concern that it may be less effectively controlled by vaccination. And the short answer to this question is yes. All of the vaccines that are approved in the United States work very well against all of the variants that have been detected so far. I'm showing data on the right from a study that came out last week looking at the efficacy of both the Pfizer and Moderna vaccines against the Delta variant. And basically what they show is that while there is a slight reduction in how well your immune system will recognize the variants after vaccination, that slight reduction is probably meaningless because these vaccines work so well. The response to the vaccine is so robust that you can lose, say, 50% of it, and you're still well above the threshold that you need to be protected. So so far that's really good news. I think that probably the best real world data for this is what's coming out of Israel right now, where they have roughly 90% vaccination rates in the broader part of the population. The Delta variant is, the Delta variant is over 90% of all viruses in Israel, but their vaccination rates are really, really high. And as a result, they're still effectively controlling the virus through vaccination. So that shows very clearly that vaccination can work as long as against variants like Delta, as long as enough people are vaccinated. Okay, next slide, please. And so this brings up another concern, which is the relationship between vaccination rates and variant emergence. And so, like I said a minute ago, vaccines are our best defense against coronavirus, as well as coronavirus variants. And to think about, the emergence of new variants, it's really sort of to oversimplify it quite a bit, you can think of it as a fairly straightforward numbers game. Basically, the more infections you have, the more chances there are for a new variant to emerge, okay? And so conversely, the lower infection rate that you have because of vaccination, the less chance there is for a new variant to emerge. Higher vaccination rates mean fewer infections. We've seen that in countries or places around the world that have been able to achieve high vaccination rates, like Israel. We've seen it here locally at the University of Illinois and within the state of Illinois, where our case numbers have dropped off since vaccination rates started jumping up in March and April. So it's really critical that we get as many people vaccinated as possible so that we can really stamp down the number of infections and thus minimize the chance for the emergence of new variants. It's really just taking away the number of pulls that the virus has at the slot machine, to go back to that analogy. And so let's see, is there another slide? No, that's it. So I went through that pretty fast, but I'm happy to go back through any of it. I think maybe now we can open up to any questions from the group, and I'm happy to talk about this or anything else related to the virus.
Thank you, Dr. Brooke. So anyone who, if you have any questions, please feel free to put them in the chat and we'll go through them that way. You guys are quiet today. So we've got a question from Brian, which is the question I see everywhere, is what is the emerging evidence of the J&J vaccine versus Delta? I'm not sure if you know that or if the vaccines
are. That's a really good question. And I'm not sure that the data are out there yet. Everything is moving very fast. So 2 studies on Moderna and Pfizer came out basically last week. And I don't know, maybe something on J&J came out earlier today or yesterday, and I haven't seen it yet. But I can't, answer that question specifically right now. My guess is because the J&J vaccine is also highly effective, that you're going to see that it will also protect against the Delta variant. I think, one of the points I want to make is that we kind of got really lucky with how well these vaccines work. And so that gives us a big cushion such that even if the immune response elicited by the vaccine doesn't quite recognize Delta as well as the parental virus, it's still so robust that you're going to be protected. So hopefully that answers the question. So I don't know specifically, but I think it will probably be pretty positive.
Thank you. So the next question is, do the PCR test and rapid tests show which type of variant they're detecting?
No, not really. So with the original Alpha variant, we kind of lucked out, and that one of the targets of the Shield test, as well as many other tests that are commonly used, actually was affected in that variant. And so you saw a really characteristic sort of 2 out of 3 target positive. And so that kind of allowed us to say, okay, that, tentatively looks like Alpha versus other cases. But that's not very specific. And certainly it doesn't tell you if it's Delta versus Beta versus any of the others. So no, the answer is no. I think there are new PCR tests that have been developed, and I think Shield is beginning to implement some of these that do specify individual variants.
Thank you. So the next question is, there's a lot of attention on vaccinations. Can you share from your perspective the continued importance of testing, even as vaccination rates are rising?
Sure, absolutely. I mean, I think the important thing to keep in mind is that the vaccination numbers are still generally pretty low. So both globally, so the United States is a huge outlier in terms of how many people we have been able to vaccinate. There are lots of countries around the world that have really, really limited to no vaccination so far, and their testing is absolutely critical, because in the absence of testing, that's really our best tool for controlling outbreaks. But even in the United States, there are regions, states that still have very low vaccination rates. And importantly, across the country, vaccines have not been approved for children yet. And so I think that until vaccination rates are high across the board in all age groups and in all areas, testing is still critical for identifying when there's an outbreak and identifying individuals who are infected so that they can be isolated before they transmit to other people.
Thank you. Another question is related to Champaign-Urbana, but I think it's, we can extrapolate to other places as well. It seems the number of active cases in Champaign-Urbana have doubled in less than a week. Do we know if it's the Delta variant, or do we not, I guess?
I don't think we specifically have know that yet, but I think because in places where they're looking closely, the Delta variant is rapidly taking over, as it has in other countries. I think it's a fairly safe assumption that the Delta variant is at least a sizable fraction of what we have circulating locally right now. But I can't, I don't have specific numbers.
Awesome, thank you.
Absolutely, what you're going to see is that because of the increased contagiousness of this virus, that all else being equal, case numbers would go up when this virus arrives.
Great. So this is sort of related to that, I think. So have you looked into why Arkansas in particular is having an outbreak right now?
Yeah, so I think one of the big drivers of that is the low vaccination rates. So Arkansas is near the bottom, or on the lower end of vaccination rates across the states. And that's what you're really seeing now is that as Delta begins to take over, we're dealing with a more contagious virus now, and you're going to see that first in states that have lower vaccination rates, like Arkansas, like Missouri, and specifically even regions of states that have, because every state's kind of variable. You have pockets that have relatively high vaccination rates. You have pockets where it's really low.
Thank you. Another question about back to this variant specifically. Do different variants present different symptoms? So the asker says they've heard that Delta doesn't affect taste and smell as earlier variants. Are there symptom differences then?
No, I don't think we have those data yet. So I'm unaware of any data showing that the Delta variant is associated with less frequent loss of taste and smell. That may be something that we find eventually, but that hasn't been shown conclusively. And in fact, it's really hard to definitively say whether one variant, causes either different symptoms or more severe or less severe symptoms than another, because the population of people who's infecting is changing. So even right now, the Delta variant is, the age profile of people being affected is lower than that than what we saw with, say, the Alpha variant or earlier in the epidemic, because vaccinations were first rolled out for older people, and vaccination rates are higher in older cohorts versus younger cohorts. So that kind of skews infections towards younger people. And in general, the virus is less, infections are less severe in younger people versus older people. Now, it's not that they're never severe, and I was just reading something really, really depressing about kids getting really, really sick very recently. But generally, you have fewer severe outcomes in younger people versus older people. So that makes it hard to say this virus is more severe than another, if that makes sense.
Sure, thank you. I've got a direct message here with a question. How do you respond to people skeptical of the vaccine? And have you encouraged, those that to get vaccinated?
So the second part first, yes, absolutely. I have encouraged everyone I know and talk to get vaccinated as soon as they can. And getting my mother vaccinated was one of the biggest sources of stress in this whole thing. So yes, I absolutely encourage vaccination, and everyone. As soon as it's approved by the FDA, I will get both of my kids vaccinated. And so I think when I try to address sort of skepticism or hesitancy about vaccination, the first thing I try and do is find out why people are hesitant, because what's the specific reason? Because definitely there's a lot of misinformation out there. But also, this is a very unprecedented situation. We've never had in our lifetimes a sort of infectious disease emergency like this, where we had to, where we've rolled out what is, a new vaccine this quickly. And so there's understandably some, concern about that. And so I try and find out what those concerns are and then address them. And then more personally, I think, as a parent, the most compelling thing I can say about my sort of trust in the power of and the value of the vaccine and the safety of the vaccine is that I'm begging all my loved ones to get vaccinated. And as soon as my kids are eligible, I'm going to get them vaccinated. So I think that tends to resonate with other parents.
Yeah, absolutely. Thank you. So here's another question about kind of vaccines and testing combined. What place does testing have in a vaccinated people in the workplace? So this asker has a workforce with about 60% vaccinated, and they test a pool of workers that work in close proximity weekly. Those vaccinated employees have been allowed to opt out. But recently they've had 2 unrelated positive cases, both in vaccinated people, causing them to maybe reconsider people opting out, even if they are vaccinated. So even though if they, might have a mild infection, they worry about the unvaccinated. So can you kind of talk about that, about when fully vaccinated individuals test positive, what does that mean for those around them?
Yeah, this is a tough question, and there's a lot of gray area here. So an important point to make about vaccines is that none of them work 100% perfectly. And if you are vaccinated and get exposed to the virus, the virus is probably going to replicate a little bit before your immune system recognizes and gets rid of it. And you probably will never know that ever happened. But the point being that if you go in at the right time and you get tested at just the right time, you're going to see traces of virus there. And we've seen this through the SHIELD program on the Illinois campus. Now, there's a lot of focus on trying to understand the potential of vaccinated individuals to transmit. I think that what's very clear from just looking at the effect of vaccination rates on overall case numbers, that your chances of being infected and transmitting to someone else if you're vaccinated are massively, massively lower than if you're not vaccinated. But it is going to happen at some low level frequency. So there's no such thing as zero risk here. And so I think when you have a population that's sort of mixed, vaccinated and unvaccinated, it's a good idea to keep, sort of maintaining some of these things that we've been doing to limit transmission, whether it's masking or distancing and testing if you have the capacity. But we're really still kind of trying to get the data to understand how we need to handle vaccinated people who've tested positive. So I think until we have better data on this, it's probably, I'd probably suggest people err on the side of caution. Eventually, as vaccination rates get high enough, we're not going to be, we'll be able to walk some of these things back.
Mm-hmm. Great,
So that was
thank you.
hopefully that helped.
Yeah, I think that's great. And the thing that you said, there's no such thing as zero risk, right? Like that, even though things are improving and people are vaccinated, it's still out there and risky.
Right.
Okay, next question is, what are the conditions for when to perform genetic sequencing? And are all positive cases sequenced?
For the second part, no, all positive cases are not sequenced, just because sequencing is a lot more complex and expensive and difficult than just performing a test. And so, what we're trying to do is sequence a certain sort of minimal percentage of positive cases in order to get an idea of the prevalence of different strains of the virus. And this has been, most effectively done in the UK, where they have a really well-funded, really well-supported nationwide sequencing program. And so they've kind of led the world in sequencing infections. And that's why we've really learned a lot about these variants from what they've done in the UK. And in the United States, we've been kind of playing catch up here. But no, all positive cases don't need to be sequenced, but I think it is good to sequence a high enough percentage that we have an idea of what's going on, so that we know when new variants of concern emerge into communities, and we can take the appropriate steps if there are any to help control those new variants.
Thank you. On that variants of interest, the latest variant to be named a variant of interest is Lambda. Do you have any information that you can share on this one?
Yeah, well, I really hope we don't make it all the way through the Greek alphabet. And B, no, I don't think we know. This is a variant that has some mutations that we think might make it more transmissible, or but we don't know yet. So that's why it's called a variant of interest. It means that it's something to pay attention to, but there's not yet this sort of documented track record of it being more contagious, or more associated with more severe disease or anything like that. I think what everyone's watching out for are the emergence of variants that will be better at replicating in people who are vaccinated. We haven't seen this yet, but that's what everyone's kind of looking for, because that's the concern, is that eventually you're going to have a variant show up where the vaccines don't work as well. And so, there's no evidence of that having happened yet. There's no evidence that the Lambda variant is more transmissible. It's just that it has some mutations. It has the people that we think we need to keep an eye on it.
Thank you. What is your recommendation for the best way to do testing at a K-12 school? What grade level should we prioritize and how often?
So that's definitely a question that's above my
Yeah.
So I think that's where it's, epidemiologists and public health experts are going to be better.
Sure.
Going to be able to provide better advice there. I think we're still, people are still working really hard to understand transmission of this virus in schools, and how it relates to age. And so I'd say, I know the CDC is working to try and understand this question so they can provide guidance on this. Mm-hmm. And I would certainly just follow their recommendations.
Yeah, and I think we're expecting new guidance from IDPH soon too, so hopefully that will help as well. And then I think the following question might be in that category as well, but I'll ask it. What modifications do you suggest in contact tracing and quarantine protocols in K-12 schools when testing is implemented?
Yeah, I think I probably shouldn't just because this is not my area of expertise, for sure.
Sure.
I think there are people who can speak that much better than I.
Sure, and we can, to those folks that are on today that are current testing sites or, interested in being a testing site, we are, working on when the IDPH guidance does come out, we will, get in touch with what that means and how SHIELD can help and those sorts of things. So more to come there. Any other questions about the variants or anything like that? Give it a second here. Okay, no more questions? Then I think we will go ahead and wrap it up for today. Thank you so much, Dr. Brooke, for your remarks and your insights. It's really helpful, especially as the variants are, in the news all the time, and we're just figuring out what that means. So we really do appreciate your time and for sharing your research and insights with us.
All right. No, thanks for having me. My pleasure.